Miss Nelson, our athletic training department, so I'll let her take it away.
Hi guys, I'm Karlie. I'm graduating in December with my associates from Weatherford College. Just a little background information, how I came up with my topic. So throughout my whole life, I grew up playing sports. So I was in basketball, soccer, cheer, rodeo, everything. So I was constantly in the trainer's room, doctor, physical therapy, everything. So it kind of sparked my interest in PT. So I have been working at a physical therapy clinic for a year and a half now, and so we see ACLs and all different types of injuries all the time. So in my class with Mr. Nelson, I'm doing my contract on ACLs, specifically Paige Becker's basketball player. So yeah, so dive in here. So first off, just what I'm going to cover. I'll talk about the anatomy, what makes up the knee, the different jobs of it. Recognizing the ACL injury, I have a couple tests I'm going to show you guys, and then the diagnostics, how you tell when you have an ACL tear. Surgical intervention, so when you have a certain type of tear, you have to have surgery for it. Rehab, of course, physical therapy, and then the prevention of how you prevent from tearing it again. So first off, we have the anatomy. Right where you can see right there, that's the anterior cruciate ligament. So what it helps you do, it connects your kneecap to your femur. And so when you plant and turn, you can tear it most of the time. It's the most important ligament in your knee. You have your ACL, MCL, PCL, and your LCL. So, and it helps keep the knee stable while you turn and cut. So here's our different grades of your tears. There's the fibers, what it looks like to be normal. Then you have grade 1, grade 2, and grade 3. Gotcha, thank you. And then, so first we're going to cover grade 1. It's the least severe. It's just minor tearing where you overstretch it. A couple things you can do to help with that. Most of the time people put braces on to like keep playing sport. Then you can also take anti-inflammatories such as like ibuprofen. And then also what we learned in class with Mr. Nelson, we learned about RICE, which is rest, ice, compression, and elevation. And so typically when you have a grade 1 strain, the healing time is about 2 to 4 weeks to recover from that. And next is the grade 2. So this is tearing about 20 to 80% of the ligament. So of course you have pain with putting pressure on it, and it feels a little unstable. And the recovery time for this is typically around 6 to 8 weeks. You'll notice swelling, bruising, of course your knee instability, and it kind of depends on if you have surgery depending on your age or activity level. So say you have an older person that really doesn't do as much, they might not require surgery, whereas an athlete might. And then next we got your grade 3. That's a complete tear of the ligament, and it's completely unstable. You cannot put any weight on it at all. And this requires surgery and physical therapy for a couple of months. So next you can see it's a pretty gnarly picture of a football player. He tore his ACL. So like I said, the most common way to tear your ACL is planting and cutting. And so we see football, basketball, and soccer are the most common sports because that's what you do in a lot of the sports is full speed running, stopping, and cutting. So a little bit more about the mechanism of the injury. Like I said earlier, sudden stop, change direction, popping, pain, instability, and swelling can cause that. And on to diagnostics. So there's different tests you can take to see whether you have an ACL sprain, although it can cause false negatives, false positives, and it's not always 100% accurate. But here's one that a lot of trainers use to diagnose on field. I pull it up this way so we can hopefully avoid ads.
Pilot. Position and bring your patient's test leg into 30 degrees of flexion. Fixate the femur with your outer hand, bring the tibia into slight external rotation, and then try to translate the tibia anteriorly. The stress is positive if you experience a soft or mushy end feel, or if the anterior translation of the tibia in the injured leg is at least 3 millimeters greater compared to the uninjured leg. Please keep in mind that your test results in a chronic situation will always be more valid than in an acute situation. The reason for this is that swelling and muscle spasm in an acute situation will have a negative influence on your test results. Okay guys, this was the Lachman.
So that was a Lachman test. And now next, we're going to be talking about the MRI. It's basically the gold standard of diagnosis. So really the only way you can truly know if you tore your ACL is through an MRI, which shows the muscles. Most of the time they're always ordered by a doctor or a chiropractor, so you have to have a script wrote for that to get one. And this is the pathway from injury. So when you have like just say an athlete, they're playing their sport and they have an injury. So you always have an athletic trainer or sometimes a physical therapist on site. And so what the athletic trainer does, they're on scene, they're the first one to the player to diagnose the injury. And they can kind of decide on whether you need more help to go on to a doctor. And so if it's minor, the athletic trainer can take care of it, but if it's not, you go on to the orthopedic doctor. And they basically confirm that you tore your ACL by an MRI, like I said earlier. They can also provide surgery if needed. And so after the surgery, you have certain restrictions to allow the full healing process to happen. And so they make a list for the physical therapist. And so basically, the physical therapist receives orders from the doctor, trying to rehab for everyday tasks and back to sport activities. And they work on movements necessary. So once you get your surgery, there's different grafts you can get to repair that tendon. So the first one is patella tendon, hamstring tendon, and then the cadaver graft. So the first one we got is the patella tendon. It's the tendon right here in front of your knee. It connects the kneecap to the shin. It's the closest thing that resembles the ACL to repair it. The only disadvantages are you get pain in the front of the knee because you're also making an additional cut in the surgery to the ACL. So you'll get pain there. And then you also have a higher risk of patellar tendon fracture because you're cutting the fibers thinner. So you can tear it easier again. But talking to different physical therapists and stuff, this is probably the #1 type graft they like to see for recovery. The next one's your hamstring tendon. It's right here in the back of your leg. So basically this one, they take a piece of your hamstring. You don't have the pain from the front of the knee because of course you don't cut the knee, you cut behind the leg. Your overall pain is less, but this also causes a longer healing process because the hamstring takes longer to heal. And then you also have less strength in the hamstring because those fibers were cut. And the last one's your cadaver graft. This one you don't require surgery on any types of the body because you have like a body donated to science that they take the pieces from. The overall pain's less. But the only disadvantages are the body sometimes rejects it, which causes infections and stuff. So there's a couple difficulties there that go along with that. So next we have our rehab goals. This is what they focus on in physical therapy. So we have your return to function, range of motion, strength, quad activation, and your run, jog, hop. And so for this, Your return to function can just be everyday tasks or back to sport. And then your range of motion for a typical person, the range of motion is 0 to 120. So 0 being your legs straight out and you can bend it up 20 degrees. But for athletes, it goes from possibly -1 to -2. And when you bend it, it will be around 140 degrees. And then strength, of course, strengthening your leg muscles back. Quad activation, that part's really important because your body's nervous system has a reflexive shutdown. So when you get injured, it tries to protect the joint, so your quad no longer fires. And then your run jog hop helps with sports and everyday activities. And so this is kind of like the protocol that most PTs have for physical therapy. And so first we start with your brace progression at 14 to 3 months. So for that one, we'll start with a hinge knee brace from 0 to 14 days, which completely keeps the legs straight. Then you'll move on to an ACL brace 14 days to 3 months after that. And then we have your crutches. The next progression will be single leg squats, straight ahead jogging, 2 leg jumping, 1 leg jumping, agility movements, and then your return to sport around 6 to 8 months. So another phase of rehab, this is phase 1. This is your week 0 to 3 motion and quad control. So some exercises we could do are wall slides, quad sets, single leg raises with quad sets. So I'm gonna have Mr. Nelson show you guys what a quad set is. So what we do in PT, we have 2 of these towels. We'll typically put the bigger one up under the heel and the smaller one up behind the knee. And then all you're gonna do is tighten your quad and you're gonna push your knee into the towel, hold for about 5 seconds, and you can relax. And we typically do this for 3 to 5 minutes. And then we can also do a leg raise with it, where you keep your legs straight. You'll pick it up, and then back down, straightening that knee. And this helps with extension and the bend of the knee. And that's for week 0 to 1. Week 1 to 2, you can do some heel raises, which is just going up on your toes and down. But one thing is you cannot go into phase 2 unless you are weight bearing. So it all depends on the doctor. One thing could happen, like when you tear your ACL, it's really common to damage your meniscus. And so that would either need to be removed or repaired, which causes longer rehab and a whole different protocol. So this would be something for like phase 2. 2 leg closed chain exercises. So closed chain is where your limbs are connected to a surface. So like, for instance, a squat would be closed chain because your feet are touching the ground. So for weeks 3 to 4, you could do some mini squats, or you could do the leg press. And then phase 3 would be your 1-legged closed chain, which would be the same thing, but 1-legged. You could do single leg squats, step ups. So it's like walking up on stairs, or your lunges, like in the picture. And this would be phase 4. You have your multiplanar movement. This one, you could do some side steps with the band, or some straight ahead jogging. So this is what we kind of use in PT. It's just a regular band. You put it around your ankles, and you can do some side stepping or monster walks. So it helps with strengthening. And then phase 5, it's around 4 months. We got your 1-legged hops, and our ladder here helps with agility. And then around 5 months, you can start kind of back with sports depending on what it is. So like a good example would be like around the 5-month mark, you can do golf because you still have the twisting motion, but it's not so much running at full speed, stopping and changing directions. But then around 6 to 8 months, you can practice like skiing, basketball, football, soccer, stuff like that. So here at Weatherford College, in the past 3 years, we have had 3 ACL tears. And so we've had volleyball and basketball. The final thing I'd like to cover is the prevention. So it's how to keep this from happening. So most people are like, core strength, what would that help with tearing your ACL? But the best way to explain it is like your body's a tree. So the core is like your trunk to your tree. So if it's not strong, then you have problems elsewhere. So here you can practice on exercises that help with like the hips, pelvis, lower abdomen. And there's a couple exercises listed on the screen. And then the next one, of course, is your leg strength, especially with your hamstring grafts. You want to focus on your hamstring strength, and balance is a big role in this. Hamstring curls, balance, and some single leg squats. And then finally, we've got your proper training technique. So you want to really focus on your form of deceleration with jumping, so it's a controlled landing, so you can land properly. And then your lateral bounding, which is just moving direction side to side. So you want to do that correctly when you're practicing, so when you're actually in the game, you can do that right. All right, that is everything. Do you guys have any questions?
Number one, I thought you were going to demonstrate all of those exercises for us. A little disappointed.
What's going on?
Because I don't know what.
I mean, we can get you up here.
Well, that's not me. No, I'm just kidding. I mean, obviously this relates to the field that you're going into, right? But I guess my first question is like, how much of this did you already know? Like from your job, from the course, what part was new to you? I guess I'll ask.
Really the anatomy part of it and the mechanical works of it all was pretty new. I've always got to see the exercises, like I said, for working in the clinic and stuff, but I never got to know what actually went into it, from the doctor's standpoint or something like that. So that was something new I got to learn.
You got that from the course in your own.
Yeah, and I've talked to different physical therapists and their protocol from different doctors and stuff, and so.
Was this kind of like a mixture of a lot of those put together then from your?
It was, yeah.
Stuff?
Yeah.
I was kind of curious about when they're doing the surgery repair, how do they decide which kind of repair to do and which ones are more common for athletes versus geriatric patients and that kind of thing, if you know anything
Yeah,
about
sure.
that.
Most of the time it typically depends on the doctor and what they like to do best. But for example, you really wouldn't want to use a cadaver graft for athletes. You would want to do something more like the patella tendon graft. But typically it just depends on the doctor and what type they like.
Okay, I gotta ask, have you had an ACL tear?
I'm not.
Okay, I was just what brought you to this, subject in particular?
So basically what I'm doing my contract on for his class is Paige Becker's, which I really like her. She's a good basketball player, but she did tear her ACL, and so I was like, I can just expand on that and do more of an in-depth thing rather than a case study. She's a basketball player for UCLA.
Oh, so I wasn't sure if she was here or she's other. Okay. I'm gonna have to go Google her later.
Just to know, it's probably easy in your opinion, but I thought it was interesting that with the stages of it. So if you're in that first stage where you're in a race, would you think that it's interesting to me that they would allow people to continue in a sport with the potential of that injury to get worse? Is that just kind of politics at that point?
So if you have an ACL tear, you really can't return to sport for 6 to 8 months. But something like if you have a total knee replacement or something like that sort, you immediately start doing exercises. You really want it to bend because if you lose that range of motion, most of the time you won't get it back. So
that's the point.
Yeah.
So in those first stages.
I'm fixing those over here. Okay, so you you showed a little video of that test, but then you said they normally the gold standard was the MRI. So then what I guess is the point of that test, and why doesn't everyone just go through an MRI?
So if you have an athlete out on the field, and they're complaining that like they have pain in their knee. You most of the time do that because sometimes it could be something else. So it's just kind of like something in the moment, like it's just kind of like on the spot. Like you just need to figure it out immediately to like understand how serious the situation is, I guess, to see if you need further care.
So is it like that way maybe they could keep playing or, ice it and then they're good, or?
I would say so, more of that, but if they're typically really hurt, you're gonna pull them out, whether that test comes back positive or negative.
Okay, Chris, now I gotta know, did you ever do that test in the field?
Oh, yeah. I mean, it's part of being an athletic trainer is
Really?
to prevent, recognize, diagnose all injuries and make a decision whether to refer to doctor or not. And so we can save a lot of money by not going to doctors
That's
if
fair,
we're
that's
able
fair.
to. We're a medical provider, and so learning tests like that can, determine whether they need to go to the doctor and get an MRI. We don't need to go get an MRI for every little ache and pain.
Makes sense.
Yeah.
You're right.
Yeah, I'm actually surprised that there isn't more injuries based on like kind of the activity in the sport. So you say, oh, there's only been 3 in the past 3 years.
That's pretty good.
Seems pretty good.
Yeah.
Yeah, we have pretty good strength
I
and
think
conditioning
that's great.
coaches.
We do a lot of prevention of injuries here at Weatherford College, and so that's a great
So I
step.
was really surprised by that. I was
Although it's
really
nice to see volleyball, because it means it happened probably recently this semester.
Yeah.
Sad for that.
Mhm.
Yes.
On the athlete that inspired you to think about this, the basketball player, I've forgotten her name already that you said, but
Take Becker.
what happened to her? Like, did everything go fine? What type of, did she get was it a complete tear? Was it a 20 to 80% tear? What kind of surgery did she have?
Yeah, so she wasn't playing in like an actual college game. She was just playing in pickup games, just kind of playing around. It was a complete tear, and she had to go through like the 6 to 8 month recovery. So she was out the complete 2022 and 23 season, and she's still in recovery right now. So.
It seems like that actually happens quite more often than in the actual sport. That you're just like trying to play and then you get hurt. You can't do your sport.
Yeah, and that's really common because most of the time they aren't in the shape that they need to be, that they would in the sport. So like playing a game, it's just little things that cause that to happen.
I know you said if they tear the meniscus, it's a whole different protocol, but how much would you say like the process is elongated by tearing the meniscus of an extra?
Most of the time, it just kind of depends on the person because every person's body is different. So you don't really have a set like amount of weeks that you would add on. But of course, like you're having another surgery, so it would be weeks. But it just kind of depends on the person.
If they did like go through the after surgery and your body did reject that, would they go back in and try like a surgery, or how would they go about that?
I don't know specifically because I've not like personally experienced it, but I would assume that they would just go in and replace it with a different type of graft. Yeah.
This thing could have a bite back home. And it works.
Can I have that look together?
Yes. So this is a piece of foam. We use it in physical therapy a lot. So it's kind of like to advance your exercises. So like something simple like standing on one leg, it gets you easy. So it really is supposed to kind of mimic grafts and unsteady surfaces. So when you stand on it, it just makes it a little bit harder.
I needed a demo for that.
But you can do
toys are up there.
You can do squats, you can do lunges, you can do all kinds of stuff with this. And I still have some of this stuff from work, but I couldn't take the rest. But you can do like slider lunges. But we have a lot of different tools and stuff that we can use.
Yeah. Do you feel that your like job has aided you in this journey here, this research journey?
Yeah, I think for sure. I got to see it firsthand. And when you're with those people, most of the time ACLs come in, they'll come in like 3 times a week. And so you're with them 3 times a week for 8 months. So you really get to know and kind of see them grow throughout the whole process. So.
One more question. Is this related? Well, not related. with what you're doing now, is that your long-term goal, or do you have other things you want to do in the medical field or expand on?
So I've kind of always wanted to go into physical therapy since I was in like 5th grade. So I kind of took this job to see if I liked it, and I do. So I'm just kind of continuing towards that. But yeah, physical therapy is the goal.
So I know you focus more on the physical aspect, but since you do work like with physical therapists, do you also see like more of like a mental thing too? Like do they psych themselves out as they go through the stages because they're afraid to like hurt themselves more and stuff?
Yeah, that's a huge part of it actually. And it kind of depends on the injury, but it really has something to do with like the neurological aspect of it. But it's a way of retraining the brain. So you just have to like assure them that there's going to be pain, but in the end, like it works out for the better. But it is a huge part of like my game.
Sometimes they'll want to like rush themselves to get back, but then like I had knee surgery before, but it wasn't my ACL or anything. And like I was ready to get back, but like once I could play again, I was always scared that like it was just gonna happen again. Like I always felt like I'm accident prone also, so like
yeah, it happens a lot. Yeah.
So, not knowing a huge amount about knee injuries, and you hear about people getting like knee replacements or things like that, how does that come off of like an ACL injury, or do you have to injure multiple parts to be eligible for that type of thing? Like how do you get to from the point of we're going to fix this via surgery to we're going to have to actually start replacing things?
So typically full knee replacements happen to people later on in life because they have ongoing knee problems and stuff. But surprisingly, that recovery is most of the time pretty, it's more quick than like an ACL recovery, because we see a lot of full knee replacements, and some people could go for a month or two and be completely good to continue on at home by themselves. So it just kind of depends, but most of the time just total knees are like the older generations.
Okay.
Yeah.
Okay, what was your favorite part of this whole process?
I like the research aspect of it because, like I said, it's not something like I really dove into, and I really liked learning about drafts because that was something like I really had no idea what happened. Like I always saw these people come in and like saw the title of what it was, but I never actually knew what went into it. So.
Final question. I promise. So what are your future, I know you said you want to become a physical therapist, so are you going to do like a PTA, or are you going to get your degree in biology and then go to PT school? Like, do you have a plan for your future?
Yeah, so the upcoming spring semester I plan to transfer to Tarleton Fort Worth. And so I'll get my bachelor's there and then hopefully go on to PT school.
Do you have a place you want to go to for PT school? Texas Tech, all right.